Welcome back to Healthcare Insight on America's Web Radio. You can find podcasts, videos. Just go to americaswebradio.com and you'll be able to find last week's session of Healthcare Insight and future sessions of Healthcare Insight. This is only our second program. So I hope if you've listened to the first one, you enjoyed it and you came back. If you're just finding us on this second broadcast, please go back and listen to the first one as we are doing a series of how we create a private healthcare system. I've had great responses from that first session. Let me respond to a couple of questions that came in. One question is Obamacare in a death spiral? Well, the answer is clearly yes. Healthy individuals and groups are opting out of Obamacare, and less healthy ones are left staying in Obamacare. The individual mandate was eliminated as of January 1st, 2019, so it's no longer a requirement that everybody in the country buy or have some sort of health care insurance. Young people weren't buying it anyway. We already had 28.5 million uninsureds, people who are willing to pay the penalty, or in fact, the penalty is never paid because the only way the federal government can actually collect the penalty is if you have a health care refund. They can't come and take money out of your bank account. They can't come and send you a fine. So there really was not a lot of penalty, and the penalty was relatively small. So what's happening to small employers who don't offer health insurance but really would like to, and the cost of Obamacare was too high? Well, many of them are going to self-insured plans. Self-insured plans are now available down to 2 lives. Can you believe it? Down to 2 lives with a combination of reinsurance products. They can now call themselves self-insured. They're called level premium plans. They're not really self-insured in the sense that a Coca-Cola or Microsoft or an Intel or a GM has self-insurance, but they qualify enough to get the exemptions from Obamacare. So if you can do some basic underwriting, which is required by the reinsurance companies, you can get into a better risk pool. You can do things that'll help your employees stay healthy, to reward and incentivize them in ways that you really can't with a small, traditional, fully insured plan. So the good groups, the good healthy groups, the younger life groups are moving into self-insured arrangements and a separate risk pool. That leaves only the bad risks still available in Obamacare, in the Affordable Care Act, whatever name you want to put on it. So yes, Obamacare is in a death spiral. And as an actuary, I can now describe this as an actuarial premium death spiral. It is at its end. It's going to end. So it's not a matter of will we repeal and replace it. The question now for politicians, Republicans in particular, who are more believers in free market solutions and not in the Medicare for all that's being proposed by Democratic candidates. The question is, what are you going to do? What are you going to do about it? You're going to just sit on your hands and wait for it to die, and then you'll take the blame. So Republicans got to step up. And that's what we're trying to do with this series of programs, describe how a free market solution can be put together and developed by Republicans, passed into legislation at the state and federal levels. So yes, Obamacare is in a death spiral. Let's take the second question that came in. Won't Democrats be blamed for the failure of Obamacare? Don't count on it if you're a Republican. The Democrats will say Republicans never offered an alternative, never put in new legislation to fix the problems of Obamacare. They just sat on their hands and let it die to the detriment of American citizens. And guess what? The media will go along with them. The media will support the Democratic line of thinking and push the argument out there that it's all the Republicans' fault because they did nothing during their years in power. So what about repeal, replace legislation? Well, last time when that was attempted, it failed, when Republicans had control of the presidency, the Senate, and the House. Now, why did it fail? Well, many of us remember that famous thumbs down by Senator John McCain that kind of killed the legislation moving forward. But the reality is the failure of that legislation started long before John McCain did his thumbs down. There's a normal process that happens in developing legislation. There are committees that will review the ideas, will debate the ideas, will offer up amendments before it ever gets to the broader Senate. The real work of the US legislature, whether it's in the House or the Senate, occurs in committees. That's called normal order. Well, the Republicans didn't want to go through normal order. They had a group, an insider group of Republicans that put together a piece of legislation and tried to bring it to the floor. And while I don't agree with what John McCain did, he was voting against both his personal animosity towards Trump, without doubt, but he also was voting against the lack of traditional order of going through the legislative process. And that's why he voted thumbs down. Now, the reality is that wasn't the final vote. That was a vote to go to committee with the House version, which was also passed by the House of Representatives. And what typically happens in legislation is the House passes something, the Senate won't pass exactly the same thing. They'll have different amendments, some different language, and they get together in a committee and they work out a joint committee bill that goes back to both the House and the Senate, and both vote then on the same bill that comes out of that joint committee. McCain voted against going to that committee, so it wasn't final legislation. If he was really against the legislation, he could have waited till the end and voted against any final bill that came out of that joint committee, but he didn't. So is repeal and replace ever going to happen? Well, hopefully, if the Republicans can get back the House of Representatives and maintain the Senate, maintain the presidency, we can do this, but you got to put together a bill that's got a process of normal order to get this stuff passed and get public support for it. There's a need for it. If the Republicans don't do it, they're going to get blamed for the failure. So what is the solution if we wind up with Obamacare in a death spiral? We get to a potential for repeal and replace with a free market private solution? Well, the solution is for Republicans to create that private market with appropriate government regulations. Too often, Republicans on the right side, the further right side than the center, the libertarian Republicans, the laissez-faire Republicans, don't want any government involvement. Well, healthcare is too complicated. You're going to have some regulatory authority to level the playing field between consumers and insurance companies, between patients and the healthcare industry that tends to try to deny them the care, make services not available, make services too expensive. You have to have some mechanisms. So the challenge for free market Republicans is, how do you do that? You know, it's real easy to create regulations around an existing industry, but we're not used to, we've never come across an issue of how do we create a free market, consumer-based, patient-centered system. That's what we've been talking about and what we're going to continue to talk about as we move forward in these podcasts. Let's take another question. If you're looking at healthcare reform, what is the most critical reform issue that we face? Well, the most critical reform issue that we face is really the existing uninsureds of 28.5 million people and the under 50 life group market and individual health insurance plans. Insurance companies have controlled the legislation and regulation to their benefit. They're not consumer-oriented laws and regulations. That's where most of our uninsureds are. That's where many, if not most, all small employers want to provide health insurance for their employees. But they can't, because the current Obamacare requires too rich a benefit, too significant a cost, and employees are left holding the bag without any insurance. You got to remember, when a small business is starting up, when there's, say, under 10 employees, maybe only a handful of employees, They're trying to survive. They're trying to develop a product or service that the public wants to buy. So they've got marketing expenses, they've got startup expenses, they got all sorts of regulatory and legal issues that they've got to pay for just to get started as a business. If anybody out there has ever tried to start up a business, you know what I'm talking about. It's not easy to be an entrepreneur. Yes, we have the best country in the world for entrepreneurship, but we make it harder and harder every day with the requirements to set up, whether it's insurance for the business, whether it's the cost of the space that you have to rent, the computer systems, all the services of trying to organize a board of directors, marketing staff, sales staff, HR department, all those sorts of things are required when you're going to start a business, whether you're doing it all yourself or whether you've hired a few people. So it's hard to get an ongoing business. So one of the things that typically is left off the table when you're very small is health insurance. Because health insurance is a large cost, it's a large ongoing commitment. But with the current unemployment being so low, employers need a way to hire employees that differentiates them from any other competition in the marketplace. That means they want to provide health insurance, they want to provide dental insurance, they want to provide vision insurance, just as large employers do. They don't want to lose all their employee prospects to large companies. So as a result, we need to make that market more affordable. We need to have products and services that may not be the richest plans in the world, but they provide good, solid coverage for employees in a startup business. Because most people are really worried about their health care. What if an accident occurs? What if there's a car crash? What if one of my kids gets into drugs? What if my wife has got some medical issue that generates itself? A disease, a cancer. We need to be able to provide health insurance for everybody in this country if they want it. There needs to be a private market, voluntary system, and that's what we've been talking about and what we'll show more over the next several sessions. So I want to thank everybody who started this process, who sent in some questions. We're going to start to talk about these issues in our next segment. So let's move forward and begin the discussion once again on how do we create a private free market system that covers everybody who wants to have insurance with good coverage, affordable coverage, covers pre-existing conditions, guaranteed issue if you want it. Sounds impossible? No, it's not. So let's take a quick break. We'll be right back and dive right into how to create a free market private health insurance that you as consumers should be demanding, should be wanting, and you as elected officials listening in should want to pass new laws and regulations to make this happen.